Hello, everybody. This is Gary. Today is October 3rd, 2021. It's 2:47 p.m. Eastern Standard Time in Rochester, New York, in the United States. And today I wanted to talk again about a subject that I've already talked about, and that is mental illness, drug addiction, and homelessness in the United States. I don't know how other countries should deal with homelessness and mental illness, but I think I know what the United States needs to do. Not all the homeless people in the United States, of course, are mentally ill, drug addicts, or alcoholics, but a good percentage is. Back in the 1960s in the United States, the civil rights movement got going, and that eventually spilled over into how the mentally ill people were really treated in state mental hospitals across the country. Conditions of state mental hospitals were horrible. There were virtually no private hospitals unless you were very rich and you could afford to put somebody in a private mental hospital. But those who were in state mental hospitals were often without clothes, crappy food, sitting in their own feces and urine, and the conditions were horrible. And so civil libertarians, among other people, started pushing for the release of the mentally ill from state hospitals. And this, of course, was based on the idea that newly discovered psychiatric drugs like Thorazine and other antipsychotic drugs would help treat the mentally ill in community mental health centers after they were released from state hospitals, and in some cases, closed private mental hospitals. I know for a fact that a mental hospital in Rochester that was known as Genesee Hospital, the entire hospital was closed down, not just the psychiatric part of it, and that took away psychiatric beds in Rochester, New York. Um, I personally spent 4 months in Genesee Hospital, which by today's standards is an extremely long time to be hospitalized in a mental hospital. Um, but if I didn't spend that 4 months in that hospital and find time to get treatment and find an apartment and so on, I probably would have been homeless. And that's exactly the problem. Ever since state hospitals have been closed, and in some cases private mental hospitals, and hospital stays have been shortened down as little as 2 weeks, mentally ill people, even if they're lucky enough to get into a mental hospital, don't have time in the hospital to find outpatient resources, apartments, housing, food, medical care, psychiatric care, and so forth, case managers, therapists, and psychiatrists. Um, in 1998, the state hospital in Rochester, New York was closed. It housed up to 1,000 patients. I spent 8 months there. It actually wasn't that bad. Um, it was better than prison or jail. And many mentally ill people, as I've said before, in the United States are institutionalized anyways in prisons and in county jails. Those are the new mental asylums. And those who aren't in jail and prison are homeless. And so the whole deinstitutionalization movement was completely misguided, poorly planned, and has led to the enslavement of the mentally ill, particularly people of color. People, people of color are in particular in the bad situation of being mentally ill and being in county jails, uh, state prisons, federal prisons in some cases, or being homeless. But of course, that also includes thousands of white people who are mentally ill, who are also homeless, addicted to drugs or alcohol, and in jails, prisons, who are homeless. And I've said it before, setting up apartments, building houses for the mentally ill is not a solution by itself. What good does it do if you put a mentally ill person in an apartment and they're not taking their medication, they're not getting treatment for drug and alcohol addiction, They're not taking their medications. They have no caseworkers, no therapists, no psychiatrists. Or if they do, they're not being followed up on. Housing alone isn't the only problem. What we really need to do before we think about housing the mentally ill who are homeless or in jail and prison is to build new mental hospitals. Not the kind that were closed down. A lot of those are shitholes and snake pits. There's a famous movie in the United States, I believe it was done in the 1950s, called The Snake Pit, addressing that exact issue. Mental hospitals were horrible places to be in. And we need to build new mental hospitals that are not snake pits. We need to spend hundreds of millions, if not billions of dollars, to rebuild mental hospitals, both private and public, to reinstitutionalize the mentally ill, force them into treatment against their will if necessary, and then think about getting them into the community in their own apartments or houses with follow-up care, care managers, case managers, social workers, therapists, and psychiatrists. All of that takes time to set up. And the truth is, people need time for that stuff to get set up. And they need to spend time in mental hospitals where they can receive treatment, not just based on whether or not they're potentially violent or suicidal, but if they can't take care of themselves. Right now, the standard in New York State and the rest of the United States is you only get hospitalized if you're suicidal or potentially violent. And even then, you're lucky if you spend 2 weeks in the hospital, if at all. I went to the psychiatric emergency room about 3 weeks ago. I was forced into a space with 45 people in the psychiatric emergency room that was meant maybe at max for 20 people. And I guarantee you, most of those 45 people who were packed into that psychiatric hospital were never given a psychiatric bed, and they were released, whether they needed to be hospitalized or not. And that's the problem. I went to the psychiatric emergency room at the University of Rochester's Star Memorial Hospital. They do the best they can with the resources they've been given, and that's the point. They don't have any resources. They don't have enough hospital beds. If you are admitted into the hospital, you will often be shipped off to another city like Newark or Buffalo, or another private mental hospital in Rochester, New York, because there's no beds at the University of Rochester. I talked to a friend of mine who lives in Buffalo. They still have their state hospital open. Rochester's was closed down in 1998. And so, even if you are admitted under the strict criteria of being violent or suicidal, you'll often be shipped off to another town or city to be hospitalized, or at the very least, another hospital in the Rochester area. In my case, what they did was they gave me 2 Ativan, 2 Klonopin, 100 milligrams of Seroquel, Zofran for vomiting, and some Zyprexa. After 26 hours of giving me drugs, they released me back into the community. I'm lucky I'm on Social Security disability. I have Medicare and Medicaid. I follow my medication regimen plan. I just got a new therapist. I can't complain. I'm not homeless, and I'm receiving psychiatric treatment. But that's not true for the vast majority of people, particularly if you're a person of color. You're not getting the services that you need. And so the solution is to spend millions, if not billions of dollars to rebuild and reimagine mental hospitals, psychiatric inpatient facilities, to give people the care that they need, and let them stay in a mental hospital for up to a year against their will if necessary, because they're already being kept against their will in prisons, jails, and homeless shelters. And even some of the mentally ill don't want to go to homeless shelters because they're more dangerous than the streets. So they would rather take the chances on the streets. There's nothing humane or protecting the civil rights of people in the current system. The current system in the United States doesn't work. Building new apartments and houses by itself doesn't work. If people are not getting treated, they're not going to take care of their apartments. They're not going to take care of themselves. They're not going to follow their treatment plans. They need to spend time in mental hospitals against their will if they can't take care of themselves. And what do I mean by not being able to take care of themselves? They're not able to shop for food properly. They're not able to stop taking drugs and alcohol. They're not following their medication treatment plan. They're not eating properly. They're not taking care of their physical health. They're not seeing an outpatient medical doctor or primary care physician. People need to be reinstitutionalized. I know that's not a popular thing to say. It goes against the grain of trying to protect people's civil rights. But no civil rights of anybody is being protected under the current system. New hospitals need to be built in every city and every state in the United States of America. We need to reinstitutionalize the mentally ill. Despite all the advancement in psychiatric drugs over the past 50 years, there's not enough effective treatment to keep people healthy without the support systems that I've mentioned: social workers, case managers, psychiatrists, primary care physicians, care managers, medication regimens that are being followed. It may not be popular to say it, but the mentally ill need to be reinstitutionalized. The system, the way it is now, isn't working. And I will keep saying that until somebody hears it. Like, comment, share, subscribe, press the notification bell when you want to find out when I put out new videos.